So thank you, Mary, and I've got the pleasure of providing some insights into how we're going to go about doing this in our system. And having listened to a number of the presentations this morning and also in the breakout sessions, what struck me was that there is a lot of resonance with some of the things I'll be talking about in this presentation in relation to the way the projects were undertaken and have led to success in the system up until this point and have been shared with you during the course of the today. So, innovation and improvement leading to success. We heard this morning that not all innovation necessarily leads to improvement, and so what we want to do is talk about innovations that will actually lead to benefits in the way we work and lead to real system improvement, and about how we create the right culture to enable those good ideas to be brought into practice. And it embraces a whole range of things which need to be in place to make sure that that's delivered successfully. A little plug for the ACI and our role, and we're very rapidly getting organised now around how we can support this happening in the system. We've had a range of additional responsibilities as a result of the governance review process that the Minister talked about this morning, and Mary's reflected on our important role in supporting innovation in the system. In terms of what we want to achieve, and these are the high-level outcomes that we're really keen on delivering on, we want to ensure that our clinicians, patients, healthcare partners and community see us as a place to go to have support for consumer and clinician-led reform in the system, to build better health outcomes for all, and it must always come back to better health outcomes. That's what we're all here for, that's what we're all passionate about. And very importantly now, our role is actually about supporting implementation of those changes. It's not just about generating the good ideas, but it's also about saying how do we actually ensure that they are put into practice and sustained into the future, because if we are going to achieve and address the challenges we face, we need to be doing this all the time, every day, in everything we do. So it's about building that into how we do business. So what is the environment? How do we create an environment that allows this to occur? We've heard that, as Mary said, most of the good ideas come from people who are actually delivering care. Often they don't feel like there's an environment that enables them to express their ideas about how to make a difference. They've got good ideas, but how do they actually make them happen? They don't feel that they're actually supported in that. There might be blockages at different points. And if that continues, then people get frustrated, demoralised, and the energy that comes from having good ideas and actually supporting them happening dissipates. I'm amazed about going to our network meetings where we have clinicians and consumers, multidisciplinary groups who come together, nurses, allied health, medical people, consumers. The passion, the commitment, the energy that comes out of those discussions to do really good things is amazing. And it's often that we have to say, hang on a minute, we can't do everything. So we do have many people in the system who want to make these differences. How do we support that happening? So we believe it comes down to a few key things. There's no doubt that leadership's important. Leadership creates the environment, it creates the vision, it creates the supporting structures. It might create some resource to enable some time for people to actually spend doing this work. And if it's seen to be important by the leadership, then the rest of the organisation will see it as important as well. Patient outcomes. We need to ensure that we're always coming back to what's of benefit to the patient in this. If you use the patient as the basis for making change, then a lot of the barriers and issues that we have in organisational sense, some of the interactions we have between people, health professionals, they can be overcome because we come back to what's in it for the patient. How do we improve that? And we heard that this morning from the presentation from New Zealand. We need to start to think about other industries. We're too insular in health. We're still too isolated and believe our industry is different to every other industry. There are so many good things that go on in other industries that are applicable to the way we do things. They need to be put into our context. There's no doubt about that. But they are able to be put into our context if we really think about things a little bit differently. One of the amazing discussions I had once was with one of the consultants who was working with us at the time, who was working in the supermarket industry and was talking about product segmentation and market segmentation, about how there are different components of that industry, and started to apply that thinking to our industry. And I was horrified initially to think that we're thinking about supermarkets and groceries and then trying to apply that to patients. But if you think about it, not all of our patients are the same. Yet often we spend our time thinking they're the same and trying to make them do the same things when we need to tailor our services to reflect their individual circumstances. And I think we heard a little bit this morning about how important that is for patients who are going through our services and receiving care, that they feel like they're getting that care and compassion and are being treated as an individual. The opportunities around that tension between what we're doing now and what's possible. How do we support that actually being brought into fruition? How do we create this sense that there is opportunity, that there is potential to do things. And I think the investment in redesign programs, supporting projects, whether they've been through the clinical leadership program of the CEC or the clinical redesign school, they've been very important in empowering people and people being able to see that there is an opportunity, that they can actually make a difference if they get those ideas supported and brought into practice. The performance targets that have been set. Often I hear that people are concerned that we've got all these KPIs, that they need to focus on doing things differently to be able to achieve those KPIs. That's a great driver. It's a real opportunity to start to think about, well, how do we deliver care more effectively? What do we do to achieve that target? If it's a target that's important for the system, how can we go about making change to ensure that we deliver? And the final one I want to touch on, but I don't want it to be used routinely, is crisis. A crisis. A few years ago, I was working at a hospital and the city I worked in had an earthquake. And it was amazing that 90% of the people who were in hospital at that time were able to be discharged in a matter of hours. The question I'd leave you with is, why were they there at all if they could be discharged in a matter of hours? And yet I think we're set up with the thinking and the culture and a process around the fact that everybody we care for needs to be within our care. And that has to be within a bed in a hospital, and I think we need to challenge that thinking. Equally, crises can make people think about innovative ways to do things, but I think if we use crises as the only way, it doesn't bring in that positive supporting culture, and I think that's one of the elements that I think is really critical to sustainability and ongoing reform. So, implementation. What are the success factors for implementation? Because the ideas are one element, but how do you actually bring that into a successful delivery? And leadership, again, absolutely critical. We've heard time and again, and in the projects we heard about today in the breakout sessions, the leadership and support and sponsorship from senior people in the organisation is so critical to success. Being able to articulate and justify the case for change, being able to demonstrate why that it is that we need to do things differently. What is it that drives us and wants us to make this change happen? How do we define the change? What is it that we can say about what's happening now, but what needs to happen that enables us to successfully get people on board, to understand what the impact of that change will be for them and how they can play a role in actually helping deliver that change? And I think planning and communication, the systematic approach, having simple, clearly communicated plans that everyone understands will help drive that change through and successfully deliver the outcome. And one that I'm really passionate about is evaluation and monitoring. And evaluation and monitoring, I think we do very poorly in the system at the moment. We evaluate after we've made the change. We don't establish baseline measures. We don't establish measures that we believe will be impacted by the change that we're going to put in place. And so we can't justify that the changes we've made are actually delivering the outcomes that we want to see. So really important that we build evaluation and monitoring right in from the outset. So how do we make it happen? I think there are a few key things. I mean, there's no doubt we need the vision and the values. We need an environment, as I've talked about, the leadership. There are tools to support change happening. Many of those tools we're actually teaching in the system now through our clinical redesign school, through our implementation methodology. There are lots of people who've got these skills in our system today. There's over about 1,500 people who've been through the clinical redesign school or the CEC leadership program or the HETI scholarships. Those people have got skills and experience and have been actively involved in making change, positive change happen. So we need to use those people and their skills. There's also the clinical redesign staff that we employ are actually out in the local health districts. There are 27 of those staff who've gone through a detailed program of learning how to support this. So we need to use those people, use those skills, use that expertise, but also have very simple plans about how we can make a difference. I think starting off with well-scoped projects that are not too complicated and allow us to deliver successfully enables a confidence to grow that we can actually make a difference and achieve these positive outcomes. So, as the DG said, it comes from people who are actually working in our system, making a difference. Those 120,000 plus staff who work right across all of our services have often got great ideas about how they can make a difference. The leadership that actually supports and creates the environment to make that happen, supported by the tools and the resources that we can provide through organisations like ours, that ultimately, by coming together and collaborating and working as teams, we can make huge differences and positive outcomes from the system. So if we do it all together, we can really achieve success. Thank you.